Well, I mean, like everyone else, I was brought up in a medical education system which wasn't entirely fit for purpose, and it was, I mean, it was very focused on specific diseases. We didn't learn anything about the environment. We learned hardly anything about nutrition, the things that I consider now perhaps most important for health. And we learned very little about the social determinants and economic determinants of health. So it was a very clinical curriculum. That's changed a bit, I think, since I was trained, but probably not sufficiently to really tackle the problems of the Anthropocene, which is very complex. And I suppose one question for me is, to what extent do medical students need to understand this broader picture? I would like to think that they may not have a detailed grasp, but they should understand how systems issues interact and can accelerate some of these adverse consequences. Also, many of the actions that I was discussing are not directly within the control of the healthcare sector. So how much do they need to know about the broader public health actions? And should they just focus on healthcare? My view is that clinicians can work very productively with other sectors. And we've seen that, for example, we've seen, for example, emergency room clinicians working on knife crime, which has been quite powerful. We've seen people on respiratory disease, consultants and specialists speaking out about air pollution, which I think is powerful.
Smoking ban example in Ireland was led by a respiratory clinician.
Exactly.
So then, of course,
I think they can play major leadership roles.
Absolutely, yeah.
And I think also because a proportion, probably a fairly small proportion, will go on and actually practice public health, we also need to convey the excitement of that public health agenda. Because I think when I was in medical school, public health seemed extraordinarily boring. So one thing you didn't want to do, you wanted to be emergency room, more exciting stuff, resuscitating people. And then when you've done that for a bit, or you've been in practice for a bit, you realise that a lot of this ill health is potentially preventable. So you're dealing with often end-stage disease, or someone comes in drunk with a head injury, and you think, well, why are we coming in centralising alcohol consumption? So you start to question that whole model of we have a society which creates ill health, or an economic system which creates ill health because the whole externalities are not internalised. And then we have a national health system which tries to rectify the problem, and of course it can never keep up. Not possible. So, and yet politicians don't seem to understand that. So I do think it's important to challenge that dominant perspective. I think a combination, you do need the disease-specific training, but you also need the bigger systems issues. And the other question is, to what extent should we have joint seminars where, for example, medical students train with architectural students or engineers? I think it would have been great, and I would have welcomed it as a medical student, to have the odd seminar, and I'm not saying the whole curriculum, but the odd seminar with, okay, students in architecture, what are they doing about some of these built environment? What are the engineers doing about energy? What are the agriculturalists doing about reducing the environmental impact of the food system? So I think in a multi-faculty institution, there's some really potentially exciting interdisciplinary or transdisciplinary seminars, which we could catalyze, with a bit more imagination. So I think imagination is really important.
Thank you very much, Liana.
Yeah, I just fully agree with Andy, and I think I come from Albania and I did train as a medical doctor. Yeah. It's quite interesting actually, because I think what that medical training used to be is the first 2 years you used to do this in a faculty where you shared benches, to learn about chemistry and physics, and maybe it wasn't about climate change or environmental health, but it was a tendency to go across other sectors. And I haven't seen that actually. I think it's much more reductive in the more recent years. I feel that transition to more clinical based training. Mm-hmm. So I do fully agree that kind of sharing that curriculum could be a starting point, but also the understanding of those systems as part of the training for the medical. And it's I think I started to talk to some of the colleagues when I was training is at the time of the Berlin Wall collapsing. So it's a symbol of a societal collapse for the whole Eastern European bloc. And it's through the practice actually that you saw this immediate effects. It was a natural experiment, an unfortunate natural experiment for the whole Eastern European bloc. But you could see the transition almost within a very short period of time, the social, economic, and actually health, because even the healthcare transforms. And it's, although, for me, it was a personal experience that drove me to go to public health, I think sharing that experience, with other sectors or other students or other professionals is probably absolutely key to be able to understand. So not just a lecture, but actually sharing that practice and sharing that practical work scenarios, apart from the clinical understanding. And I do feel that that's probably, one key building block for the next generation of clinicians to be able to work across the communities and this broad house concept.
Right, so support for public health for undergraduates. Let's see what some of the people who organize medical education may have to say, medical in broad sense. I don't know, William, would you like to say something? I was going to, yes, please.
Yes, I can say something I will not say in my presentation. In the past, many years ago, I was also a professor of medicine and organized, because it is mandatory in Europe, a course in humanities, human science, and the School of Medicine for medical doctors and for all health professions. In this course, there were anthropology, health psychology, that is patient-doctor communication, and something else, ethics. I was very interested in the presentation of Francesco Salustri. What means economy? Who is Greek here? It comes from Greek. It is something like the laws, the rules of the house and of the heritage. This is economy. And we teach something similar to economy in medicine, in the hygiene, public health, that is cost-benefit analysis, evidence-based medicine. Okay. My personal opinion, after 20 years of experience in this special course, not only in my university, but throughout Italy, is that the younger students, first, second year students, may be interested in environmental issues. And it is a matter of strategy, it is a matter of expertise, it's a matter of how you can teach. What the people are learning now is very much about how to become healthier by diet, by physical fitness. Always in the past, I was very, very young, there was a project in Italy and also in the United States, joint project. The name was Let's Move. And it was driven in the United States by Michelle Obama, together with us. The point is we must provide examples, but also experience, and have the resource for doing it. The result may be orthorexia. Maybe you know what it means. It means an excessive attention to food. It is mirrored also by anorexia, mental anorexia. Yes, orthorexia. It is healthy food and going forward with healthy food. Another former experience, my personal experience, but also of the European Medical Association, was putting forward the Mediterranean diet in Europe, of course, but also in the United States, 15 years ago. Our counterpart in the United States was Walter Willett and all the School of Public Health. He was a fanatic of fitness with 10 degrees below 0 centigrade, not Fahrenheit. went to the institute cycling was not my my preferred way of. What I would like to bring here is, and I will say later, which can be the contribution of any medical society, any medical association. I am not here representing anymore any university, and not a scientific society, but a medical association, quite free, very similar to the Royal College of Physicians. Mm-hmm. But you know, Royal College of Physicians London, muted. They have a new president now. I am a fellow of the college. And it is very different from several years ago. Mm. And with a target different, probably. But I think we can still do something as associations and also with this kind of meeting. Because what you presented for me was mostly interesting. Planetary health is a great idea, a great vision. And also the information on aerosol and climate, very important. It's not a common knowledge on this issue. And also your article, yes, this is your article in New England, I remember, Journal of Medicine, the imperative for climate action to protect Earth. Is 6 years ago, before COVID. Mm-hmm. After COVID, everything changed. Prevention became vaccines, masks, and so on. This is not prevention. This is not only this, of course. And the other interesting point for me, new point for me, is not all green and not all trees are good for a good atmosphere. Mm. This is an information that should be spread, disseminated, probably also in England, but everywhere in Europe. The other point, we work in this field, we collaborated, is the barbecue, a danger. And also was very interesting, your methane lesson. I understand are only single points, but I am just saying what was very interesting for me because raised my curiosity, probably also my memory, but also my curiosity. So the point can be not only rules, but also strategy, psychological strategy.
And Guglielmo, could I check? Are people online able to hear this conversation?
Yep, we can hear it.
Good.
There's a hand up.
And there's a hand up from Timothy Malone, is that correct? It's frozen, I think.
Yeah.
While we're waiting for that, might I ask while you're here, because I know you're leading.
I'll lead a lot more. So, yeah.
Yes, could you elaborate for us about powerful interests that are blocking action?
Yeah, thank you. So, I mean, that's a very important question. And, you know, we've known for some time that the commercial determinants are really important determinants of health. The work of people like Anna Gilmore and Mark Pettigrew at London School, Anna Gilmore and Bath, have shown that commercial factors, commercial influences are obviously responsible for many tobacco-related deaths, alcohol, big food, and of course, fossil fuel industry as well. We're increasingly aware of the activities of the fossil fuel industry. And I think one of the reasons that we're seeing the weaponization of misinformation at the moment is because many of the scientific truths, and I use the word truth advisedly. I mean, obviously there are uncertainties. There'll always be uncertainties in science. But overall, we know the direction of travel is the wrong direction. And the reason that we're seeing scientific misinformation at the moment is because these scientific evidence threatens the business model of many powerful industries, including the fossil fuel industry. We're going to see in Brazil, sadly, I think, the fossil fuel industries and some of the sovereign wealth funds and so on, the big national fossil fuel funds, are going to be blocking tangible progress, as we've seen increasingly in the COP process. And we also seen that in the plastics treaty very recently. We've seen how a few powerful countries and powerful interests are blocking progress on the plastics treaty. So I think increasingly, I mean, if you'd have asked me a few years ago, I'd say let's try to establish communication with some of these industries and see if we can work together to refocus their business model on a more sustainable business model, which could be good for health, good for the economy. Sadly, I don't think that's possible, because I think they've made a decision, which is what they're not going to give up. And they're going to extract every last dollar out of fossil fuels, irrespective of what the impacts are going to be. And maybe we also see that to some extent. I think food we can debate. I mean, to what extent the food industry, the food industry is complex. Some food industries are more on the side of sustainability, others are undermining sustainability. Some companies do both. On one hand they do one thing, one hand they do the other. So it gets a little bit complex. And fossil fuels, of course, what the fossil fuel industry say is, well, you need energy to relieve poverty. True. Poor people need energy. But they don't necessarily need fossil fuel energy. In fact, if you just provided the basic energy to alleviate extreme poverty, that would be about 1% of greenhouse gas emissions globally. So we don't need to massively increase greenhouse gas emissions, even if you addressed it by fossil fuels. So that's a bogus argument. So I do think that we need to increasingly tackle these bogus arguments and these vested interests. To what extent you do that in medical education, I think is an interesting question to discuss. My own view is you need to teach and involve medical students and other students in thinking critically about how you evaluate evidence. And in their professional lives, they probably will be challenged by powerful interests at some point or another, depending on what they're actually doing. So it's important for them to have their own views about how they might respond to that, either as individuals, individual citizens, or as health professionals, or in their professional bodies. So would they, for example, support their own professional body in speaking out about climate change or air pollution, whatever? That's an important discussion that needs to be had with students, I think. We can't tell them what to do, but I think we should at least raise that when we're talking about ethics and so on. It's not just ethics of individual clinical consultations. It's also the ethics of the economy in which we live. And I remember once being asked to go to the Global Bioethics Conference about 10 years ago, and I put this case to them. And what was fascinating was that there was about one person out of hundreds of ethicists who was really interested, and the others wanted to talk about minutiae of clinical trials, how you get proper consent for a clinical trial. Well, okay, it's important, but it isn't threatening. It isn't threatening to undermine global civilization, to be honest. And yet there was a kind of inverse attention law. They wanted to focus on the minutiae and not the big picture. Maybe that would change now. I don't know, but I think it's very important to raise it with the students and around.
And also how increasing technology in medicine ties in with the increasing technology demand for energy and the way that the information about that is not being disseminated.
Yeah, and how much is that really benefiting people, or is it just medicalizing?
I would like to thank you for raising this important strand of the discussions that you made. May I just go back to online hand raised by Timothy Malone. You had your hand up for a while. Please speak.
Thank you. Can you hear me all right?
Yes.
Excellent. Good to see you, Andy. You came down to us in Exeter, I think, in November 2018, and gave a talk on our Waking Up to Planetary Health conference then, which was fantastic. A couple of things I wanted to pick up on. I think the transdisciplinary nature of I think is very, very important. I think the whole of our European and education, medical education in particular, we've gone more and more into silos, deeper and deeper silos, and the emphasis has gone away from emphasising how important it is to know what your colleagues up the road in a different department are doing and what their aims are. You don't need to understand it all, but at least you need to know who they are and what they're doing, and to actually work together. And that's actually quite a difficult message to get across to medical school staff and medical school teachers, who actually see their role as just becoming more and more experts in less and less, and we have to change that. The other change I've seen, and Andy, since you came down, we've started teaching all our year 2 medical students here in Exeter. That started just as the pandemic started, and they all have a 3-week module in global and planetary health. So for the last 5 or 6 years, we've been doing that. One of the things I've noticed is actually the students now, this year, are less concerned when they come in than they were 5 years ago. And of course, these are students that have been born post-millennium, when they've grown up. The planet is in crisis, and the Earth is in crisis, and it is normal that they see it as completely normal that we are facing a planetary health crisis and climate crisis and an environmental crisis. That just has been there all their lives. They don't remember a time before that, and that's something I felt I've noticed in the last year or so. It's something new, and I don't know quite how you reinvigorate this is an abnormal situation that we all face. Yeah. So I wonder if you've got any comments or suggestions on how to do that.
Yeah, well, I don't have a magic wand, I'm afraid, but thanks for the question. It's a really important one, and I do think we all experience that kind of psychological and emotional distancing, don't we? From if, for example, it seems an intractable problem, you think, well, I don't want to think about this. It's very difficult to make progress. So I do think, although I'm personally very convinced of the need for systems change, I do think we need to break things down into manageable steps. So I think we need both the incremental impacts, and we need to talk to your nephrologist and your cardiologist and so on. How does it all fit into their clinical practice? Because there are things that can be done. But at the same time, we also need to think, well, it is a bigger picture. I can't necessarily influence all of that, but I need to be aware of it so that I'm an educated and concerned voter, for example. I have an influence in my community, which shouldn't be underestimated as a health professional. So you can play that more generic role. And I think we should be equipping students better, both to think how they can integrate this into their specialist practice, or if they're a GP, into their general practice, and then what is my bigger role as a citizen, both of my city, of my country, and so on, a member of my professional organisation. So I think it's partly a feeling of impotence, perhaps, that people feel, well, I can't influence very much because I'm one person and I can't influence these big changes. But I think we can encourage them to brainstorm how they might have a tangible impact collectively, perhaps, as a voice. By the way, I've been very impressed with the IFMSA, the International Federation of Medical Students Associations. In the work that we've been doing on climate change and planetary health, the IFMSA has been a really consistent voice, I think, for action. And the medical students have played an important leadership role, often more leadership than the senior colleagues. So I think we should celebrate that and also empower them. So yeah, you should keep pushing against the senior colleagues. I know as a dean of an institution, if the students come to see you, you have to respond. You can't just ignore them, otherwise you're going to store up a lot of problems. So keep on nagging.
One of the other points you raised, I think, is also very important, the ethics. You're right that medical ethics tends to just focus on the individual patient. And I found that as quite a dilemma, that whenever you speak about ethics, and you think, actually, but I have to consider that I might be harming, future generations and many other patients in the future, in the way I treat individuals, and whether it's to do with the issues of sustainability, how much plastic, what happens to drugs, the drugs we use. We have very little information on the environmental impact of drugs. Very little information is put on the patient information or the doctor information leaflet about it, and the companies aren't interested. And you think we have to change our focus on medical ethics, making it broader. That we owe a duty to our community and our future generations, as well as the individual patient in front of us.
Yeah, fully agree, Timothy. Absolutely right.
Thank you very much.
Thank you,
Mr. Malone. And there's only 2 minutes left in our discussion, but I wonder if, Camille, you are willing to respond to Andy Haines' challenge that you stop talking to the industry, at least the fossil fuel, because in your work, you are finding some ways of having a dialogue, I believe.
Yes. Hold on. Can you hear me okay?
Yes, very well. Thank you.
Yeah, thank you. It was a really interesting talk. I think the one point that I really liked was the fact that we're getting more and more evidence on the impacts of climate change and environmental health on human health, because I think that will really help in the teaching. Instead of giving case studies, we can give more evidence-based teaching, and that will really help convince the students and the faculty. So I really like to see that, and if there's anything that you can think medical educators can do to help get that evidence or galvanize how that evidence is collected, that would be great. You asked me to talk about the link with pharmaceutical industries. The Energy Network is sponsored by pharmaceutical industry, by the Sustainable Markets Initiative. And we've had really good dialogues with them in terms of helping implement the education and in a really good way. So I think that it is possible. I have no relationship with any fossil fuel industry, however. I think they might be a little bit harder. But it's nice to know that some selected pharmaceutical industries are interested, and this may be due to some of the targets, and it's something that I will talk about in my talk later on today.
Thank you. That's very reassuring that we can distinguish different strands of the industry, and we can develop our strategy based on this awareness. So I would like to thank again Professor Andy Haines for the time of giving his keynote and staying for the discussion. We should say, thank you very much, and likely to correspond about outputs of this meeting and related